When they let you into Pitt and they choose you to be a part of the program, they're picking you not because you met some admission requirement, they're picking you because you meet the graduation requirements and that they believe that you have what it takes to become a great, safe, strong CRNA, and they're going to turn you into that.
Favorite part of my job is watching a student going from novice to expert.
They're giving us a lot of room to grow as individuals.
And I think that's really rare, that the faculty come down to your level and talk to you and really try to make the program better for you.
They adjust the curriculum, they adjust the workshops, and they change things along the way.
Since I've been program director, we have more than 1,000 graduates of this program. And that represents about 2% of all the anesthesia providers in nurse anesthesia in the country.
Very well renowned in terms of the cutting edge research that they do, in terms of simulation, the scholarly research that they do in nursing as a whole. And I also pursued it because of its commitment to increasing the diversity within nurse anesthesia.
Evaluate the cuff pressure to make sure it's not.
I don't know that many places can match the clinical experiences that we get for our students by being partnered with UPMC.
The proximity to UPMC is a great pipeline for us nurse anesthetists for excellent jobs and to be a part of all of those medical advances.
It's an amazing group of talented providers who show our students everything from how to walk into an operating room and get dressed in the right spot to doing really complex cases like liver transplants and open heart surgeries.
Close the APL slightly.
We have exceptional facilities and simulation.
I think for many students, actually putting a needle deep inside a patient to do a block or to do a line is really anxiety provoking. And to have a chance to actually gain that skill and be confident and safe before you have to do it with a real patient in a real setting is really a confidence booster. I'm very proud that we've embraced that. We're considered one of the top programs in the United States in our expertise in simulation.
If we're doing nasal, right?
When I shadowed other CRNAs, how highly regarded the University of Pittsburgh School of Anesthesia was, I felt like if I could get my foot in the door, then I could be able to take myself places.
Among all the nurse anesthesia programs, Pitt is one of the few that has been ranked in the top 10 since rankings started about 25 years ago.
Pitt nurse anesthetists have a reputation of being excellent.
You know anywhere you go that when you say that you came from Pitt and trained at Pitt, people are going to say, that's great, we trust you, we know you're going to take great care of our patients.
We take our 360 syringe and we get rid of whatever.
Our students today are smarter than we were when I was a student, constantly challenging us as faculty with new ideas and new thoughts.
When I hear back from a student, hey, I was taking care of this patient, and I remember when I worked with you in the clinical setting and we handled that kind of case, and it just came back to me just the way we discussed it, just the way we did it. Hearing them say how now they are the ones that are out there precepting and teaching people in the same way. I think that's a really exciting thing to have as an instructor.
You know, my goal this entire time has been to make the University of Pittsburgh the best nurse anesthesia training program in the United States. And I think we've succeeded.
200 mics at epi versus 100.
When you're studying and you're getting ready for this new career, you want to know that you're going to have a great job to move into. And it's really nice to know that being a Pitt grad, people will be coming after you.